scenario we're going to be looking at is post-operative pain, okay, post-op pain of the patient. Now, in this particular case, okay, the patient had an operation, okay, had a cesarean section, and is now in pain. And the nurses have asked you to see the patient. And when you see the patient is screaming in pain. Doctor, I'm in pain, I'm in pain. Help me, please. I'm in pain, I'm in pain, I'm in pain. Okay, that's what we find. So what we do in this particular case is you can assess it as usual. You look at the monitor, all observations are normal, but the patient is screaming, I'm in pain, I'm in pain, I'm in pain. What are you going to do? Okay, you have to do an ABCDE. We said either the patient symptomatically is unwell or the vitals tells you the patient is unwell. In this case, despite the normal vitals, symptomatically the patient is unwell because he's screaming in pain. So how are you doing, Mr. Brown? Doctor, I'm in pain, I'm in pain, I can't breathe, I can't breathe, I can't breathe, I'm in pain, doctor. Doctor, I'm in pain, please help me. Since the patient is talking, the airway is parted. Okay, Mr. Brown, let me just look at your monitor. You look at the monitor, everything normal. Okay, can you tell me, go to the history. Can you tell me about your pain? You do the Socrates. Where is the pain, which is important? The pain is in my tummy. Okay, so pain is in your tummy. Okay, you're going to do the whole Socrates for the pain. Then the differential diagnosis, which is going to be, understand you had an operation. You're going to start thinking of the differential diagnosis. And we know here there can only be one thing, complication of the operation. Specific history, what specific question you're going to be asking? We're going to ask about the operation. So I understand you had an operation 1 hour ago or 2 hours ago or 3 hours ago. Was there any problems during an operation that you are aware of? I don't know, doctor, I'm just in pain. Have you been offered any painkillers at all? Okay, have you been offered any painkillers? Okay, so all this trying to ask the patient. Then you're going to say, okay, I need to check your post-operative notes to see what was done and if there was any complications. And you also need to have a look in your drug chart to see if you've been given any medications for your pain so far. Okay, so the operation, you're going to have to check the notes. You look back into the task. The task will give you information. You may have the patient's notes in this station. You may have post-op notes in the station, telling the patient had a cesarean section under spinal anesthesia, lost about 200 ml of blood, okay? Lost about 200 ml of blood, and he was given diamorphine. So you're gonna find that written in your task itself or written in the patient's notes, or any other information, any complications, you may find them on the post-operative notes. Then you have to examine. I need to examine you. Again, same examination of the chest is going to be normal. Okay, good. So normal examination. We don't need investigation. Observations were normal. Chest examination normal. Why would we do some unnecessary investigations? 2, circulation. You're going to assess everything will be normal. You still need an ECG. Okay, because the patient is post-operatively, you want to examine abdominal and external genitalia. There is a catheter, it is draining. There's abdominal pain, okay, because it's only what? It's post-operatively. When you palpate on the abdomen, it's screaming in pain because it's got it, it's post-op. Circulation, it's okay, take the bloods, IV line, send the bloods. But don't give IV fluids because the blood pressure was normal or everything was normal, okay? No IV fluids. Patient is alert, is talking to you. People's glucose, check on normal. Review the ABCs, you didn't offer any treatment. Okay, so we come to E. We have done an abdominal already of this patient. We have done the external genitalia. The only thing we didn't look at the legs, okay, to inspect it and palpate. There is no pain, in redness, nothing else. So patient is stable generally from the beginning. Okay, so we're going to explain to the patient now and say, I have examined you, Mrs. Brown. Of course, you have got a pain in your tummy and you just had an operation done. Okay, so I feel that the cause of your tummy pains is a post-operative pain just because of the operation. But I've assessed you, there is nothing else going on that may put your life at risk. I have assessed you, there is nothing going on that may put your life at risk. Okay, so what I'm going to do, I will write up a prescription for you to give you morphine. Okay, because you're in so much pain, I will prescribe you 10 milligrams of morphine. Okay, and I'll find a nurse to come and give you the medication. If you were to prescribe this patient, you have to give it oral, not IV, not subcutaneous. Oral morphine is in severe pain, and we would prescribe it to the PRN section. If there is a drug chart in the station, you can attempt to prescribe it, but usually they will tell you don't not to prescribe because it's not a prescribing station. Don't expect the patient would improve immediately, okay? Because in real life, you assess patient is in pain, you need analgesia. You would write up the analgesia, then you have to find a nurse who come and give the patient the medication. So all you need to do is to apologize. I'm sorry, Mrs. Brown. I'm going to write up the medication very quickly, and I'll find one of the nurses to come and give you some medication. Okay. I am sorry, of course, that you are in pain. Okay. So this would be this particular task.